If you're over 50 and you walk every day thinking you're protecting your health, what I'm about to tell you might make you pause. Because I've seen patients who believed they were doing everything right, only to discover that their daily walk was quietly putting stress on their joints, their heart, and even their blood sugar. Before we go any further, if you care about your health and want simple, honest guidance like this, take a second to like this video and subscribe. It helps more people hear information that could genuinely make a difference. Now let's talk about something most people don't realize. Walking is often called the safest, most natural form of exercise. And in many ways, that's true. But after the age of 50, your body changes in ways that make just walking a little more complicated than it seems. Your muscles lose elasticity. Your joints become more sensitive. Your balance may not be what it used to be. And your metabolism, especially how your body handles blood sugar, can shift in subtle but important ways. I've seen this happen too many times. Someone tells me proudly, "Doctor, I walk every day." And they do. But when we look closer, they're dealing with knee pain, stiffness in the lower back, rising blood sugar levels, or even fatigue that doesn't make sense. And here's the truth. It's not always about whether you walk. It's how you walk. Small, overlooked habits, things that feel completely normal, can slowly work against your body instead of supporting it. These aren't dramatic mistakes. They're quiet ones. The kind that build up over months and years until your body starts sending signals. Signals many people ignore. What makes this even more concerning is that these mistakes don't feel dangerous in the moment. They feel routine, comfortable, safe. But your body keeps a record of everything. And if you don't understand what it's trying to tell you, you might miss early warning signs that could help you avoid bigger problems later. So as you listen, I want you to think about your own routine, not with fear, but with awareness. Because sometimes the smallest adjustment can protect your mobility, your heart, and your long-term independence in ways you didn't expect. And the first mistake is something almost everyone does without even thinking about it. Most people don't realize that one of the most damaging walking habits after 50 is walking too slowly without intention. Now, this might surprise you, because you've probably been told that walking at any pace is better than not walking at all. And yes, movement is important. But when your walking becomes too casual, too slow, and lacks purpose, it may not be giving your body the support it actually needs. I've seen this happen too many times. Patients tell me they walk for 30 or even 40 minutes every day. But when I ask them to describe their pace, it's more like a relaxed stroll, barely enough to elevate the heart rate or engage the muscles. And here's what that means for your body. As we age, our metabolism naturally slows down. Your body becomes less efficient at managing blood sugar. Your muscles require more stimulation to stay strong. And your cardiovascular system needs a certain level of challenge to remain healthy. A slow, unintentional walk may feel comfortable, but it often isn't enough. What I'm about to tell you might change the way you think about your daily routine. When your walking pace doesn't slightly challenge you, when you're not just a little out of breath, when your arms aren't moving, when your posture is relaxed to the point of slouching, your body doesn't receive the signals it needs to adapt and improve. Instead, it simply maintains, or in some cases, gradually declines. This is especially important for blood sugar control. After meals, a purposeful walk can help your body use glucose more effectively. But if your pace is too slow, that benefit may be significantly reduced. And it's not about pushing yourself to exhaustion. That's not the goal. It's about intention. A walk that supports your health should feel slightly brisk. You should be able to talk, but not sing. Your arms should swing naturally. Your steps should feel steady and engaged, not lazy or dragging. Even a small increase in pace can help stimulate circulation, support joint health, and improve how your body processes energy. But here's where many people go wrong. They either walk too slowly or they suddenly try to walk too fast without preparing their body. And that leads to the next mistake, one that often shows up as knee pain, hip discomfort, or even lower back strain. And most people never connect it to how they walk. Another mistake I see far too often is poor posture while walking, and most people don't even realize they're doing it. You might think standing upright is obvious, but after 50, subtle shifts in your posture can quietly sabotage the benefits of your daily walk. Slumping shoulders, a forward-leaning torso, or a tucked-in chin may seem harmless, but over time they create strain on your spine, hips, and even your heart. I've seen this happen countless times. Patients come in complaining about neck stiffness, shoulder tension, or an aching lower back, and when I observe how they walk, it's immediately clear. Their head juts forward, their shoulders round, and their gait is short and uneven. These seemingly minor posture issues can increase pressure on your joints, reduce lung capacity, and even slow circulation. What makes this especially concerning is that posture affects more than just your muscles. When your chest is collapsed, your lungs don't fully expand, which can lower oxygen intake. Reduced oxygen can subtly affect energy levels, endurance, and even how your body manages blood sugar. You might notice fatigue after a short walk, or find that your energy dips mid-afternoon more than it used to. This is your body signaling that something isn't optimized. Correcting posture isn't complicated, but it requires mindfulness. Keep your shoulders back but relaxed. Gently lift your chest. Let your head align with your spine instead of jutting forward. Engage your core slightly to support your lower back. And notice your foot placement, landing softly and rolling naturally from heel to toe. Even these small adjustments can make a massive difference. Your joints move more efficiently, circulation improves, and your body can extract more benefit from every step. In fact, a strong posture while walking can help protect against age-related decline in balance, reduce the risk of falls, and make your walk a powerful tool for heart and metabolic health. Most people don't realize that walking with slouched or unaligned posture is not just a minor habit. It's a silent factor that can undermine decades of effort. If you've been struggling with aches or low energy despite daily walking, this might be the reason. And the next common mistake ties directly into this one, something almost invisible but incredibly harmful. Improper foot mechanics that strain your joints and disrupt your body's natural rhythm. This is one you'll want to pay close attention to. Many people don't realize that the shoes they wear, or don't wear, can quietly sabotage their walking routine, especially after 50. I've seen it too many times. Someone is committed to walking daily, yet they experience knee pain, hip discomfort, or even swelling in their ankles. When we dig deeper, the culprit is almost always footwear. Shoes that lack proper support, cushioning, or alignment can drastically change the way your body absorbs impact. Think about it. Your feet are your foundation. Every step sends a shockwave up through your ankles, knees, hips, and spine. If that foundation isn't stable, every joint along the way compensates, often without you even realizing it. Over time, these small compensations can lead to chronic pain, poor balance, and even contribute to posture problems we discussed earlier. Most people choose shoes based on style, habit, or comfort alone, but the right walking shoes can support natural motion and reduce strain. Look for shoes that offer adequate arch support, a firm heel counter, and cushioning that matches your gait and weight. Your foot strike, how your heel lands and how your toes push off, matters more than most people think. Improper mechanics can create repetitive stress, which may exacerbate conditions like plantar fasciitis, arthritis, or even mild joint degeneration. And here's something many don't consider. Old shoes, even ones that feel fine, can lose their structural integrity. A pair you've worn for years may no longer absorb shock properly, subtly increasing stress on your joints with every step. Replacing your shoes regularly and ensuring they fit your current foot shape, because feet change with age, can make a profound difference in how your body handles walking. Another factor is walking barefoot on hard surfaces. While occasional barefoot activity can strengthen certain muscles, habitual walking on concrete or uneven surfaces without proper support can accelerate joint wear, especially for those over 50. By simply choosing the right footwear and being mindful of your foot mechanics, you can protect your knees, hips, and spine while maximizing the cardiovascular and metabolic benefits of walking. Most people don't realize that a small change in shoes can feel like a huge difference in energy, comfort, and overall health. The next mistake builds directly on this concept. It's something subtle that almost everyone overlooks, ignoring the importance of warm-up and mobility before your walk. Skipping this step can silently set you up for injury, fatigue, and less effective health benefits. One of the most overlooked mistakes I see in walkers over 50 is skipping warm-ups and mobility exercises before hitting the pavement. Most people assume walking itself is enough to loosen their muscles, but the truth is, starting cold can silently stress your joints, strain your muscles, and even affect how your body handles blood sugar and circulation. I've seen this happen too many times. Patients proudly tell me they walk every morning, yet they arrive with stiff knees, tight hips, or a sore lower back. They're doing all the right things on paper, but the lack of a proper warm-up is quietly undermining their routine. The body doesn't instantly adapt to movement. Your muscles, tendons, and joints need a few minutes of gentle preparation to activate safely. Simple movements, like ankle circles, knee lifts, or gentle hip rotations, can significantly improve your range of motion and reduce the risk of injury. Even a 2 to 3 minute dynamic warm-up primes your body for a walk that actually supports your health. It's not complicated, and it doesn't require special equipment, just mindful attention to how your body feels. This step also influences balance, coordination, and blood flow. Properly warmed muscles are more efficient at supporting your joints and using oxygen, which means your walk can be more effective for heart health and blood sugar management. Skipping this step often leads to subtle fatigue during your walk, or soreness that lingers afterward, signals that your body is working harder than it needs to. Most people don't realize that warming up can also enhance posture. Loosening tight shoulders, back, and hips allows you to maintain proper alignment throughout your walk, maximizing the benefits for circulation, energy, and metabolic health. So, if your routine has been just stepping out the door, consider adding even a brief 2-5 minute warm-up minute. You'll notice your stride feels lighter, your joints move more freely, and your overall energy improves. And once you pair this with proper posture, shoes, and pace, your walk transforms from a casual stroll into a true health-promoting exercise. The next mistake builds on this principle and is one of the quietest health saboteurs: walking for long periods without paying attention to hydration and blood sugar levels, something many over 50 unknowingly overlook, but that can impact your energy, heart, and metabolism in subtle ways. Most people don't realize that staying hydrated or not is one of the silent mistakes that can undermine a walk after 50. I've seen this too many times. Someone walks for 40 minutes, feels sluggish, or notices their heart racing, and they assume it's just fatigue from age. But often, mild dehydration or low blood sugar is quietly sabotaging their energy, circulation, and even joint comfort. After 50, your body's ability to retain water and regulate blood sugar shifts. Thirst cues can become less obvious, and subtle dips in hydration can quickly affect how your muscles contract, how your heart responds to exercise, and how your joints absorb impact. Even mild dehydration can cause fatigue, dizziness, or a feeling of heaviness that makes your walk less effective and less safe. I've seen patients who thought skipping water before their walk was harmless, only to experience tight calves, headaches, or even lightheadedness halfway through. Similarly, walking right after a large meal or on very low blood sugar can leave your body struggling to maintain energy, making your walk feel harder than it should. These small imbalances may seem minor, but over time, they can influence heart health, blood sugar regulation, and overall endurance. The fix is simple, but it requires awareness. Drink a glass of water 15 to 20 minutes before you walk. Carry a small bottle if you plan a longer route. And pay attention to your body's signals. Slight fatigue, dry lips, or an unusual heaviness in your legs may mean it's time to sip water or have a light snack with complex carbs and protein. What most people don't realize is that hydration and blood sugar aren't just about feeling better. They directly influence how your cardiovascular system responds, how your muscles recover, and even how effectively your body burns energy. Walks done without these factors in mind may be far less beneficial than you think. By taking this small, mindful step, you not only protect your joints and energy levels, but also maximize the health benefits of every stride. And the final mistake, the one that ties all of these together, is something almost no one notices until it's too late: neglecting variety and recovery in your walking routine. This is what truly separates a health-supporting walk from a walk that simply burns time. The last mistake, and one that's surprisingly common, is neglecting variety and recovery in your walking routine. Most people think that as long as they walk every day, they're doing everything right. But the truth is, repeating the same route, pace, and motion day after day can quietly limit your benefits and even put strain on your joints and muscles over time. I've seen this too many times. Patients tell me they walk the same 2-mile loop at the same easy pace every morning. On the surface, it seems healthy, but over months and years, the repetitive motion can contribute to overuse injuries, joint stiffness, and a plateau in cardiovascular and metabolic benefits. Your body thrives on variation. Slightly different routes, varied terrain, alternating pace, and including intervals or gentle inclines can activate muscles in new ways, improve balance, and challenge your heart more effectively. Recovery is just as important as movement. After 50, muscles take longer to repair, and joints need rest to stay healthy. Walking every day without alternating lighter and slightly more challenging sessions can lead to fatigue, soreness, or subtle injuries you may ignore until they worsen. Incorporating rest days or active recovery, like gentle stretching or yoga, allows your body to rebuild stronger and maintain the full benefits of walking over the long term. Another aspect most people overlook is listening to your body. Not every day should feel the same. Energy levels, hydration, sleep quality, and even blood sugar fluctuations affect how your walk impacts your health. Ignoring these signs can reduce effectiveness and increase the risk of strain or injury. The good news is that small changes make a big difference. Switch up your route, add slight inclines, alternate pace, and allow recovery days. Pay attention to how your muscles feel and make adjustments when necessary. Over time, this not only protects your joints, but also improves balance, energy, and cardiovascular health. Walking is a simple, accessible, and powerful tool for health after 50, but only when done with awareness, intention, and care. By addressing these 7 overlooked mistakes, you can transform a routine walk into a practice that genuinely supports your heart, your joints, your blood sugar, and your long-term independence. Most people don't realize how much impact small, mindful changes can have. But the difference is profound. Your body will thank you for every intentional, supported step you take.